Hello, good morning, everybody. I think we can make a start. We have a few people in, and I'm sure others will join us as they become available. My name is Laila Adwan Kamara, and I'm the team lead on this program, Ghana Somubi Jumadie. And I have the real pleasure and honor of welcoming attendees to the webinar today on behalf of the program. And I'm just really delighted to have you here at today's webinar. It's an issue that's been really close to my heart, and that with great interest I've watched colleagues from Mental Health Authority, from Tropical Health, from the program work together to really try and make genuine change happen in this space, and really to make sure that we establish the Mental Health Review Tribunal, which has been described as groundbreaking, hence we put it in the title. So I'm really happy to have you here today. I think you're going to find today's webinar really interesting and informative. I'm just going to do a tiny bit of housekeeping before I hand over to today's moderator. So I think firstly, just so that you know, we have enabled closed captions. So on your toolbar, on your Zoom toolbar, you'll be able to see a little icon which says CC on it. And if you click on that, you'll essentially get live subtitles coming up. And we hope that's helpful for people who need that. We're really sorry that we don't have a sign language interpreter available today. Also, we had some comments from people joining about whether they'd be able to get a copy of the presentation. Yes, you can message us for a copy of that, and we'll share it with you. And if I could just remind people that use of AI, especially AI models like Otter, are not permitted in this webinar. It's because it essentially scrapes participant data, but please do use the closed caption button if you need the subtitles. Okay, so very importantly, we want to hear from you. So in the chat function, this is another little icon at the bottom of your Zoom toolbar with a single speech bubble. If you type in the chat, we will love to hear who you are, where you're coming from, what you're interested in today. That will be really super. And if you want to submit a specific question for the moderator or for the speaker today, then just click on the little Q&A function, the little button at the bottom of your toolbar as well. It has two little speech bubbles next to it. Using the Q&A function really helps us to see your question and not to miss it. It could get missed if it's in the broader chat. Okay. So that's my housekeeping done, and now it's really my great pleasure to introduce our moderator for today, who is Edwina Segura-Agro. And Edwina is a psychiatric nurse and lawyer. She has over 10 years of experience in the field of mental health, and she actually made history as the first female psychiatric nurse to be called to the bar. And I mean, this is just a fantastic achievement. Thank you, Edwina, for coming today and sharing your expertise with us, and also all of the work that you've done on making the tribunal happen over the last little while. And I think this really demonstrates Edwina's unwavering dedication to advocating for the rights of individuals with mental illnesses. And as a frontline healthcare worker, Edwina was part of the teams trained to combat the Ebola and COVID-19 pandemics, putting her skills and knowledge to the test in the most challenging of circumstances. And we all remember living through that. So thank you again, Edwina. And she's also promoted mental health awareness and education, as well as collaborating to develop support programs for healthcare staff. Now, as a lawyer, she's driven to bridge the gap between the justice system and psychiatry. Edwina is also a devoted wife and mother and works hard to prioritize family time, as we all should, Edwina. Thank you for your example. And she's committed to making a lasting impact in the fields of psychiatry and law. So, Edwina, I'm now going to hand over to you the rest of the webinar to moderate. Thank you so much, and over to you.
Thank you, Laila. Good morning, everybody. Welcome to our webinar. We hope that at the end of today, would come up with great ideas and then would have learned from each other. And it will be a very fruitful one, of course. So just before I introduce our speaker for the day, it's been an interesting experience working with our speaker, going through all the training and all the knowledge he's shared with us on how to handle the tribunal, and with his great ideas and with the help of the Mental Health Authority and Ghana Somubi, it has been one good experience and it has been fruitful. People are interested, more patients would want to know more about it, and we are hoping that at the end of today we'll get more ideas to know, to map out the way forward for the future. So our speaker for today is a consultant on non-communicable diseases and public mental health. He's a clinical psychologist by training. He has been involved in public health policy and legislation, as well as health advocacy for 40 years as researcher, activist, developer, and implementer. Until May 2018, he was Chief Director for Non-Communicable Diseases at the National Department of Health of South Africa for 9 years. And from 1996 to 2002, he was the Director of Mental Health and Substance Abuse. He is an expert advisor to the World Health Organization, and as a consultant to the WHO, has been responsible for writing numerous documents on mental health policy and legislation. He has held research and consultancy positions and published extensively on matters of public health, including health system and services, mental health and HIV, youth and mental health, community care, and many more, just to mention a few. He was the chief drafter of South African legislation that introduced Mental Health Review Tribunals to the country in 2002. And later he served as a chair of one of the tribunals. He has a particular concern regarding the social determinants of health and illness and ensuring a holistic and integrated approach to care. He holds the position of Professor Extraordinaire at the University of Stellenbosch. My attendees, it's my honor to introduce to you Prof. Freeman, Melvin Freeman. Please let's welcome him. Thank you very much.
Thank you, Edwina, and hello to everybody, and thank you for joining us on this webinar, which is going to be looking at the groundbreaking establishment of the Mental Health Review Tribunal in Ghana, who can be helped by it, why, and how. I should probably just say at the outset that I'm a little bit time constrained, but we are going to have quite a bit of time for questions at the end. And so if I move through some slides quite quickly, just remember that you can jot down your questions and we can come back to the slides later and have a look in more detail if you want to, or otherwise we'll make sure that you can have access to those slides. Just to remind you to follow Ghana Somubi and to download our key activities. Okay, right, so what are we going to do today then? We're going to start by looking at issues around the fact that persons with mental health conditions have human rights just like any other person. Now, many of you will probably say, well, this is an established fact. Why do we have to go back to this all the time? Well, we have to go back to it because there are many people who actually don't respect this, and that people with mental health conditions are still discriminated against. And in fact, the Review Tribunal is one of the ways in which we try to ensure that people with mental health conditions have rights. So we then look at some of the main purposes of the Review Tribunal, how it was established in Ghana, and then the main point, who can be helped by the tribunal, why and how, and then we will look at some of the recommendations for setting up a review tribunal given the experience of Ghana. So, as we said, persons with mental health conditions have human rights like any other, but these rights are denied very often And this occurs in communities in which people live and work, as well as so-called care and rehabilitation centers in both the formal and the informal care sectors. So deprivation of rights include things like direct and indirect physical and psychological abuse. We know people are chained, they're isolated, they're beaten, they're threatened psychologically, and so on. And that this happens in, for example, religious rehabilitation centers, but also in hospitals and institutions that are set up by governments to care, treat, and rehabilitate persons with mental health conditions. But even laws discriminate, and not every country now still allows people with a mental health condition the right to vote, the right to marry, the right to sign contracts, and so on. So there is still a lot of discrimination. We also know that there is quite a lot of intrusive and irreversible treatments that take place, and people need to be protected from that too. But one of the most pernicious and common abuses that sometimes isn't necessarily seen as an abuse, but it is depriving a person of their liberty and freedom and treating them without their consent. And we just got to be very clear that any decision to deprive a person of their liberty is a huge, huge decision to make. It's of such gravitas or seriousness that if it has to be done at all, and we can question whether it ever has to be done, but if it ever has to be done at all, it should never be taken lightly. So some people and some countries feel that it's okay to take away a person's liberty, in other words, to detain them for psychiatric admission and treatment, and that the family or a friend of the person can make such a decision. But this can be abused, and very often is abused. And even sometimes people have the best interests of a person at heart, but it isn't necessarily what that person would want in the circumstances, or that an independent group of people examining all the facts would come to a decision that might be different from that family member wanting the person to be kept and treated. We also can't have a situation where it is a healthcare professional, and especially a healthcare professional alone, that is making a decision to deprive a person of their liberty and freedom by detaining them in a mental health care facility. If we allow that to happen, this is not only a huge burden on the person that's making this decision, but it would be an opinion based primarily on a medical perspective, if we're talking about a healthcare professional making this decision, and would usually be made without the facts or the full facts that are necessary to make such an important decision. So, deprivation of liberty without a due legal process and without very careful consideration can be seen as a major abuse of rights. So you can see where I'm moving to, that there needs to be due legal process before any kind of detention or deprivation of liberty can take place. And if we do it without due legal process, it's very much like a detention without trial. And I'm from South Africa, and I have a lot of experience from the old apartheid days where people were simply detained without trial. This is illegal in terms of international law, and really is an abuse of people's rights. But we also can look back historically at, for example, in the old USSR, whereby if you disagreed politically with what the country wanted you to believe and you were a dissident, they would say, you've got a mental illness. They even had a term for it, sluggish schizophrenia, and you were then detained in a psychiatric institution without due legal process. So that's detaining a person, but similarly, treating a person without their consent is also, or can be also, a serious invasion of a person's rights. Now, I'm sure that most of you know the UN CRPD, and there was a general comment on Article 12 of this convention, whereby there's been a very strong call and a movement to outlaw any involuntary care and treatment at all. But most countries have not yet, or perhaps will never adopt this position. And many regard Article 12 of the Convention, the article that some people say should be interpreted as meaning there should be no involuntary care, to rather favor the view that there should be careful review if there is going to be involuntary care. And Article 12 specifically says that that it should apply for the shortest time possible and should be subject to regular review by a competent, independent, and impartial authority or judicial body. And this is where review tribunals come in. Internationally, the main purpose of mental health review tribunals is to review cases of patients detained under mental health legislation and to direct the discharge of any patient for whom the statutory criteria for discharge have been satisfied. In other words, if a person is detained under mental health legislation without their consent, they should be able to either apply to a tribunal or routinely seen by a tribunal so that all the evidence can be considered, and that if a person does not meet the criteria, they can be discharged. So there are variations in tribunals, and in some countries, for example, the tribunals themselves make the decisions around whether a person can be admitted or treated without their consent. And as I was saying, in others, it is made by a court of law, and the tribunal can then be used to review that decision. Of course, tribunals are also often given additional responsibilities, but making decisions around liberty and freedom and around admission and treatment or detention and discharge is central to why tribunals exist. This is one of the slides where I'm not going to spend a lot of time, but I've just looked at a couple of countries, the UK, New South Wales and Australia, India, South Africa, to just look at some of the differences between the countries, but very importantly, tribunals in all the countries can discharge a person if they do not meet the criteria. It's also constituted by different people depending on levels of resources very often, but in most cases, tribunals have a legal person, a medical person, and a lay member or community representative. So, the process of setting up the review tribunal in Ghana was a long one, and in fact goes back to 2004, where at the request of the government of Ghana, the WHO was brought in to provide some technical support for the developing and drafting of the mental health of mental health legislation at the time. And it was in this process that Ghana agreed that it was a good thing to put in a review tribunal. I have to say I was part of that WHO delegation those 20 years ago. Then there was a fairly long consultative process in which the legislation was developed, and in 2012 the Mental Health Act was passed and assented to by the President in that year. But it took quite a number of years with the legislation in place for action around the tribunal to actually happen and its establishment to actually occur. But in June 2022, the Mental Health Authority in Ghana nominated 15 tribunal members representing 3 pilot regions. Then there was an inauguration in November, and a 3-day orientation and training of review board members happened. This was to really get people au fait with what they could do, what had been happening in other countries, how they might meet, how they might do hearings, and so on. And then there was a manual that was written to assist the tribunal members and hospitals too on roles and functions of the tribunal and how it could be used. And then in May, the first tribunal actually met, May of this year. And then just a short while ago, there was another orientation of the Mental Health Authority and hospital directors. And so even once the tribunal has been established, others needed to know more about it, how to access it, and to make sure that it was used in the way it was intended. So we need to look then at who can actually use this tribunal, who can make an application to the review tribunal. And what the law says is that an application may be made to the tribunal by or in respect of a person detained under the Act. And the application may request a review of the conditions on which the person is detained. They can ask for a discharge of the person, or they can make any other appropriate, or they can ask the tribunal to take any other appropriate action with respect to the circumstances of the person with mental disorder. So why should anyone utilize the services of a review tribunal? Hopefully in the short presentation already, it's become quite clear that the review tribunal is established in legislation to protect and promote the rights of persons with mental health conditions. In particular, though, the review tribunal protects the rights of people that do not give their consent to admission and treatment. If a person gives their consent, then they should be treated like anybody else with any other condition, with any other physical health condition, even if they might have a mental health condition. But if they do not give their consent, and if certain other criteria are met, then the tribunal can consider this and can, so that the person gets the highest attainable standard of health, and because they have a right to life and others have a right to life, the tribunal can make decisions with respect to admission and treatment of a person even without their consent, if they are unable to make that decision due to their mental health condition, and if certain other criteria such as danger to self or others is met. But the tribunal also looks at long-stay voluntary users, people that cannot give consent to ECT and other irreversible treatments. This is, of course, the review tribunal in Ghana that I'm talking about, and people subjected to seclusion and restraint. In short, people should make use of the tribunal because it administers to them and advances and improves their lives. How can people make use of this tribunal? Well, in order to make use of the tribunal, it's essential that all relevant people are made aware that the tribunal exists and what they do, and they must know how to practically access it. So some of the practical recommendations that have been made in Ghana to make sure that people know about the tribunal and use it is that each hospital or place where a person is detained under the Act shall inform all users of their rights under the Act, including their right with respect to the review tribunal. So everybody in hospitals who is kept there without their consent should be told about the tribunal. And each hospital or person where a person is detained should be keeping the forms so that people can fill them in and it can be sent through to the tribunal. But information about the tribunal should also be made available through other sources, and the rights of a person with mental health conditions need to be explained with respect to the review tribunal. So we need to inform users, yes, we need to inform family members, we need to inform community members, and we need to use various mechanisms such as posters, pamphlets, voice notes, TVs in waiting rooms, and other ways of getting people to hear about the tribunal. And information regarding the existence of the tribunal, its functions, how to reach it, and so forth, must be made available to different government departments, to NGOs, to groups of people with lived experience, international development agencies, and others. We had a workshop recently involving many of these stakeholders, and many of them didn't know about the tribunal and were quite put out by this. So there has to be quite a lot of effort to inform people about the tribunal, otherwise it's not going to be used. Also, the private sector in mental health also needs to be informed about the tribunal and how to and the Act in relation to the tribunal when admitting patients. So they also have to abide by the law. So once a complaint or an application or appeal is received by the tribunal, they have to apply what we call their collective mind and come to a decision. And because there are different categories of people on the tribunal, somebody with a legal background, somebody with a medical background, somebody who comes from a community, a psychologist or social worker, they all together bring their own perspectives. And if necessary, the tribunal needs to do more investigations so that they can come to a just decision in the work that they do. And the work has to be done within the timeframes outlined in the Act, and then the decision of what the tribunal decides has to be carried out as you would a court order. And of course, the review tribunal must carry out all the duties and responsibilities given to them with due diligence and commitment. So very briefly, these are some of the recommendations for setting up a review tribunal from the experience of Ghana. Having legislation that creates mandatory review tribunal is fundamental. You have to use legislation to establish this, otherwise it's not going to work. Secondly, the process of establishing a functional review tribunal is a complex one and requires commitment, effort, and resources. So if you're going to get external support, such as was provided in Ghana, that can be done and can be very helpful, but an outsider should never take over the functions that the country has to go through in establishing the review tribunal and making it functional. They must be the leaders in this whole process. Another lesson is phasing in tribunals through not trying to establish it to cover the whole country in the beginning. You can do it in phases by starting small, learning lessons and moving on from there. And then also a step methodology with clear and manageable objectives is very important. So in Ghana, there were 6 steps that were followed: appointing the tribunal, orienting them, establishing a manual that they can use, having an extensive consultation process, then you move into implementation, and of course one shouldn't forget about the monitoring and evaluation phase. So you need to carefully plan the establishment of the tribunal, and breaking this into logical consecutive steps is extremely useful. We also got to remember that implementation requires resources and commitment from the authority. The supply of the tribunal that is ready and able to consider cases and fulfill its functions is imperative, and the authority needs to make sure that it is functioning, that there is the administration there, that people know what they have to do. But at the same time as providing a tribunal or supplying it, simultaneously, there needs to be adequate knowledge and information regarding the tribunal so that the demand for the tribunal is high and people actually use it. Otherwise, having the tribunal is actually going to be a bit of a waste of time and resources. And of course, I did mention setting up a monitoring, evaluation, and learning system is essential. So, I'm coming to the end of this presentation, but I just want to say that from a personal point of view, I have very little doubt that if this tribunal and any other tribunal that is established in any country fulfills what it's been established to do, then the lives of many people will change and will be improved, and human rights will be promoted. So, looking forward to the discussion and questions around any of the issues I've raised, or I'm sure Edwina will join me in answering issues related to the tribunal in Ghana and perhaps steps going forward from now. Thank you very much.
Thank you very much, Melvin, Prof. So we have questions. I'll just remind all of us to submit our questions to the Q&A. And if you would want to also ask your question verbally, you can actually raise your hand and you'll be called to answer to ask your questions. So I'll start with the first question. Thank you, Andrea. So the first question, Prof, is that what monitoring processes are in place to ensure that hospitals and institutions correctly implement the provisions that have been presented? Example, making forms available and informing people. And the second question we have is, in South Africa, how are the operations of the tribunal funded?
Thanks for those questions. Between us, Edwina and I will try and answer questions because she's there on the practical end of things. I've been a consultant to this project. But what I do want to say in relation to the first question is that we have recommended that there should be extensive monitoring and evaluation of the process of implementation, and that one will only know how well things have worked if one actually measures in the beginning, measures the progress, and then measures periodically. And I agree with the question that there does have to be a specific monitoring to see whether the recommendation of ensuring, for example, that everybody in the hospital knows that they have the right to appeal or to apply to the tribunal actually is taking place. Now, what we have experienced so far in this process from my outsider perspective is that we need to balance what we've kind of called the supply side and the demand side. So we can't have a situation whereby the tribunal is not ready to see many cases because it hasn't been funded or resourced adequately, and the demand is very, very high. At the same time, we can't have a tribunal which has been set up and people don't know about and don't apply. So getting that balance right, I think, is a very important one as one moves through these pilot phases. And I think it is important to again emphasize that we are in a pilot mode, not because we just want to do those areas, but because we want to learn as we provide services in those areas and implement them there, and then we can move to other regions as well. So I appreciate the question, and perhaps Edwina can also respond to it. But maybe let me take the second question also, and then we'll come back to you, Edwina, about the funding in South Africa. In South Africa, the tribunals are funded by the government, by the state, in the different provinces, but also, I have to say, are underfunded. In South Africa, I think what is quite interesting is that the tribunal is meant to make decisions on all involuntary care. It doesn't first go to the court and then there's an application or appeal. And that has forced the tribunals to do a lot of decisions from paperwork rather than having hearings for each and every case. And the funding that would be needed if every case had a proper hearing would be, there wouldn't be enough. And so funding does determine how one does one's work, and the extent to which one can do what is ideal. So yes, the state does fund it because it is set up in legislation. And I think I want to emphasize this again also, is that if something is set up in legislation, it is a mandatory function for the government to carry out if it is a government responsibility. And in my view, because the review tribunals are set up by the law, they must be funded. Otherwise, the state is itself impeding its own laws or the implementation of its own laws. Edwina, do you want to respond?
Okay, so I think I'll just add on to the first question asked. So with monitoring processes, earlier this year we did actually visited the regions where the tribunals had were set up, just to understand the challenges since the implementation of the tribunal, to understand the phase that we are in. So if we are scaling up, we sort of know the things we have to do better. And in doing that, we appreciated the challenges, and I think it informed us on the need to train. So we organized more training, and there was a stakeholders conversation. So periodically, there's going to be more of that. There's also going to be encouraging the various institutions to carry out some form of data collection to see how we've improved. And since the introduction of the tribunal, how service delivery has improved. So, and there are also forms. So one of the things the hospitals do is that when you are being admitted, they sort of also inform the patients, educate them on the presence of the tribunal and the grounds upon which they can apply to the tribunal. And I think your Andrea, your follow-up question in answering that, as in I think you asked that if people with mental health conditions have been coerced into institutions against their will, the assumption is that both people who sent them there that's example, their family members and the staff of the institutions themselves are not upholding basic human rights, and they may in fact actively try to prevent people with mental health conditions from accessing the tribunal. What mechanisms are in place to prevent this and ensure people can access the tribunal? So in our acts currently, all involuntary patients, before they are admitted, they are supposed to get an involuntary order from the courts before they are being admitted into the institution. So if any institution is having a patient who is an involuntary patient there, without this order, it's against their rights. And yes, maybe with the initial stages, they would be there, and they can't, in the few days that they are there, that the psychosis is high, they may not be able to make decisions of their own. But we've had instances where people have actively made reports on, reported an institution for abusing their rights. There's also a call center set up at the authority that gives people, everybody, the right to call and make complaints. So there are other avenues and then we have every platform that they can access to make their complaints. And we are working on it. One complaint that was just brought in through social media is actually being worked upon, and then we are making investigations to find out what went wrong. So there may be lapses, but we are trying our possible best to make sure that at every point in time, all the patients or every patient can access the tribunal. And as Melvin said, we are putting up posters in the hospitals, letting every patient know that you can access the tribunal. We've added a call center number where people can call in, ask further questions about them, and then they'll be educated on the works of the tribunal. And if a patient is there, wants to access the tribunal, there's a secretariat that is set up at the Mental Health Authority where they can actually just petition straight on their own that they want to be discharged and they're being held against their will. And then the tribunal sits and looks into the matter. I hope this answers your question. So that's about it. And I think there was a question on which regions the tribunals are being piloted currently. So we have in the Greater Accra region, in the Central region, and in the Ashanti region. So those are the three regions that the tribunals are currently being piloted in. There's a follow-up question. There's a question, thank you, Mr. Kusalensu. His question, Melvin, is that per your presentation, why is it that in the UK, the medical person is not a psychiatrist, but just a medical doctor?
I mean, it's not really up to me to answer this, but it varies from country to country. And, you know, if I compare that to South Africa, for example, we have what we call a mental health care practitioner who can be on the tribunal. And that can be a psychiatric nurse or a social worker with psychiatric experience. So it will depend on what the country decides is feasible and reasonable in their circumstances. And maybe a psychiatrist is not absolutely necessary, and other mental health care practitioners bring in other ways of thinking that are just as relevant to the tribunal. But I suppose what is also important is that in Ghana, and I assume in the UK also, the tribunal can bring in experts to help them to make a decision. So in Ghana, if the tribunal wants to bring in another psychiatrist to help them to make a decision and to examine the person, then they can do that. And I imagine in the UK that's also possible, and they will probably also invariably interview the treating psychiatrist in coming to the decision. So one just needs to look at what is reasonable in one's own country and write that into the law. I have to say I was a little bit surprised that Ghana managed to write in a psychiatrist onto each of these tribunals because of the lack of resources, but that was the decision that they made. And, from a human rights perspective, it was probably a very good decision.
Okay, so thank you. Just before I read the next question, I think Jeanette is having difficulty submitting her question. So if she wouldn't mind, she can ask her question. She's allowed to just unmute and ask her question directly. Okay,
Hello.
so hello.
Hello. Can
Hello.
you hear me?
Yes, we
Can
can.
you hear me? Can you hear me?
Yes.
I think the question I wanted to ask has been answered by you, because I don't know whether you have a tribunal for the mental health patients, because I know where I'm coming from. The mental health system, they have legal practitioners who stand in for the mental health patients. And so I wanted to find out if in the mental health system or the healthcare system here in Ghana, we have tribunals that speak on behalf of the mental health patients. But I think listening to what you just explained, it looks like you are now starting, right? Am I right?
Yes.
It looks like Ghana is now starting to put the legal system in place on behalf of the mental health patients. Is that right?
Yes, but I would want to explain the legal aspect. So there's the tribunal that says that sort of ensures that all patients in all the psychiatric hospitals are there because they want to be there, not because someone else is forcing them to be there. And so they have the room to make applications for their discharge, if they have any thing they would want to say, or any view they have, or something they want to petition about, or any complaint or something. But with our act, they have rights to petition their discharge. And even if the tribunal sits to prolong their care, they can actually appeal against it. So yes, I think it started in 2003. So it's been in place for a while. Hello. Okay, since we can't hear her, I'll just quickly read the other question so that we don't run behind time. So we have a question from Prof. Ernest Tope. Prof, will you say the tribunal can be reasonably effective even if they use the approach as is generally being used in South Africa currently, but with diligence? So I'll give you a number of questions before you answer. So that's the first one. The second one, mental health is a big challenge in the society. I learned one of every 10 persons may have the disease. People's rights will have to be protected. Do you think people with mental health in Ghana need tribunal to fight their rights, or we rather need funding to educate and care for people with the disease? And the next question is, will there be a circumstance where a patient will be denied to use the tribunal? So those are the 3 questions for you.
Thanks. Okay. I'm glad that the participant who asked the question about South Africa and said, do you think it will be reasonably okay if you do the reviews like we do them in South Africa, if you do it diligently? And I suppose my response is yes, it's reasonably okay. It's not ideal in my view. And when I was a chair of one of these tribunals, I have to say the quality of the review was so much better when we actually did hold a hearing and we did have family members coming to give their points of view, and we could hear the treating doctor and the nurses where the person was being kept, and hearing the views of all of these people in coming to a decision. But what we try to do in South Africa, which I suppose makes it reasonable, is that one looks at the information that is provided with and all of the documentation relating to the case. And if there are any things that don't look clear-cut, then to try and have a hearing. So it doesn't mean to say that if you get it as a paper review, you can't also then have a hearing if you're not satisfied with all of the information that you've got in order to be able to make a really informed decision. So I think it's got to be a balance between having more paper reviews and hearings. And because resources are scarce, you have to compromise at some level. And the fact is that people can appeal. And also within the South African situation, if there's an appeal, then it is done as an in-person hearing. So I hope that that answers that question. The whole issue about balancing resources between human rights to have a fair trial or a fair hearing when your freedom and liberty is being constrained versus the right to health and, for example, spending money on drugs or treatment rather than on a tribunal is a really, really difficult one. How does one balance different rights? I absolutely agree that people have the right to the highest attainable standard of health, and that means that resources have got to go into that. But I also believe strongly that people have a right to liberty and to freedom. And money needs to go into that. So it is a country balancing act, I think, to decide how we decide which rights are more important than other rights. And maybe that's also the wrong way of looking at it. I think all the rights are very important, and how does one balance the resources rather to get the rights right as much as possible, because you can't get the ideal. We would obviously like as much money as possible to be going into both of these things, into a tribunal and into better care and treatment. Okay. Sorry, the last question, I think, just remind me, Edwina.
I think that it has to do with a person being denied access to the tribunal, and I think I'll just quickly wrap up on that. And that's no, a person cannot be denied access to the tribunal. That's why we've also made other avenues available for people to make their complaint. So that's why we have the call center. That's a national call center that you call and you can make any complaint that you want to. I think there's another question that has to do with the court structure of Ghana, whether the tribunal is independent of the Mental Health Authority, and it's better that we see the tribunal as part of the Human Rights Division of the High Court. And yes, that's a conversation that is ongoing, and we are hoping that that would be made visible within the the years to come, but they are independent. The Mental Health Authority does not interfere in their work. They write to the hospitals directly and just copy the board. They make their own decisions, and the authority has nothing to do with what they do. It's just that it's just the board that is all in the known of what they have to do, because they have to be copied and because they've constituted them. So that's to answer that question. And thank you everybody for joining us today. We hope that this conversation and this webinar has been very, very educative. It's an ongoing conversation. We are still working to make it much better than it is now, and it's a work in progress, but it's very, very, very effective. And so we are very grateful that everybody from all walks of life, from different countries, had the time to join us on this. And please kindly take notes that there are other webinars ongoing, and we hope that you would be interested to join in those other webinars. Thank you so much, and we hope you have a very good day today.
Thanks from my side too.